Good evening, everyone. We are so glad to be able to do another StationMD live event. We're going to give people a few minutes to kind of log in and join us. I don't know where you all are across the state, but here in the Southwest region, it's wet and cold. But don't worry, it's typical Missouri. It'll be 85 degrees on Wednesday. So if you don't like the weather in Missouri, just wait. It'll change. So we'll wait one more minute.
Sure.
We've got a great discussion in place tonight. We've put it on the discussion that we're going to talk about COVID in light of flu season, which I know that we're all beginning to think about that, and Missouri is already beginning to show positive cases of flu A and flu B, so it's a timely discussion. Let me give you a couple of housekeeping things to keep in mind. During the presentation tonight, we will not be able to answer questions live. Now, we will respond to questions following the presentation in the next few business days. So if you have questions or you have comments or things that you'd like more follow-up on, leave us a comment down below, and we'll look into it and post a response to the Facebook page comment. But like I said, we will not be able to answer those questions tonight. Let's just give you a brief reminder. This is our second StationMD live event. StationMD is I'll give you a little bit of information, but Dr. Kat will give us some information in a little more depth. But the Division of Developmental Disabilities is contracting with StationMD, and we've started that partnership with them back in March and April. Obviously, when the pandemic started to rear up full force, for our individuals to participate in our Medicaid waiver programs to avoid the hospital if at all possible. StationMD is, I guess I liken it to a virtual urgent care, and they have the ability to treat individuals that have developmental disability that participate in Missouri's Medicaid waiver. It's virtual. So if you can FaceTime or you can Zoom, you can connect with a doctor, and it's always a doctor. It's not a nurse practitioner, and obviously there's no disregard for nurse practitioners, but you're always going to be working with an MD or a DO. So it's of no cost to our individuals. So sometimes they've asked, is that going to come away from my annual budget? No, this is above and beyond. You won't see a line item in your annual budget. This is just a service and a support that the division is partnering with to ensure that folks can stay out of the emergency room in the hospital unless you just absolutely have to. So I'm enough talking, right? So let me introduce you to Dr. Devin Unadkat. He is the Chief Medical Officer for StationMD. And we're just really excited to have him here this evening. So I'm going to turn over to you, Doctor, and let you introduce yourself, and we'll get started.
Wonderful. Thanks, Matt. I really appreciate you having me here. And thank you for the introduction and introducing the program. StationMD in Missouri have collaborated greatly over the last few months, and I think the partnership is growing, and it's growing well. So I'm very pleased to be here and have the opportunity to speak to everybody. So a little bit about myself. My name is Dr. Devin Unadkat. I'm an emergency physician. I've been in practice for approximately 20 years or so, and I've worked in numerous emergency departments, trauma centers, community centers, freestanding emergency departments, observation units, and urgent care centers. And throughout my history of working in these emergency departments, myself and my partners realized that there was truly a need for a service in which we can connect with patients before they get to the hospital. Essentially, do a virtual house call. Get the doctors that people want to see into the home without having that patient come into the emergency department. because we felt in our experience, and to be honest with you, it's come to fruition, that there were numerous cases where we could avoid the trauma of transfer, bringing patients from their home, from their setting, with their caretakers and the people that and their families that they know, and the families that know them well, to an environment that, quite frankly, is traumatic, scary, and it is a situation that can make a small illness snowball into something that's very, again, I keep saying the word traumatic for patients. And we founded StationMD about 4 years ago, and we found the success in the Northeast. We started in a few sites in New York, and grew from there. And now we're in 8 different states. We take care of 25,000 individuals with developmental disabilities, and we're proud of that. Our doctors are all trained in taking care of patients with disabilities, and they're also all board certified physicians trained in the United States. So I feel honored to have the privilege to take care of our patients, and I hope that we're doing good. Our track record it's pretty good. I think we keep about 80% of our patients at home, though there are times when we do have to send patients to the hospital. But I think we do at least give each one of our patients a fair shot of staying in at home and being taken care of with the highest level of quality.
And we agree. We concur wholeheartedly. The feedback we're hearing from our folks that receive our supports and services is that it's very positive. It's easy, and it takes a great burden off of their shoulders. So we're excited to be able to offer this support. So, Doctor, kick us off. Let's talk a little bit about, kind of the similarities with flu season coming on and COVID still being present. What are some of those similarities between the two common fall, winter kind of respiratory issues?
Yeah, thanks, Matt. So, I guess first we should really talk about what are these common fall and winter illnesses that kind of overlap with the symptoms of COVID-19. So COVID-19 is something new, like we all know, over the last 6 to 8 months. It's kind of been on every single news channel. So I'm sure most of our viewers have heard some of the symptoms of COVID-19. But what you'll also recognize is those same symptoms overlap with things like the common cold. Things like seasonal allergies. The fall time is a big time for seasonal allergies. And of course, influenza. So those four illnesses kind of have similar symptoms, and it may be very difficult to differentiate one from the other. The good news is that, all of these illnesses, for the most part, most of our patients will do well. Throughout the country, most patients end up doing well with any of these illnesses: influenza, COVID, the common cold, and obviously seasonal allergies. But our patients in particular, those with developmental disabilities, are at a higher risk for having complications of both influenza and even the common cold, and of course, COVID-19. So some of the similarities between these, some of the symptoms that you'll run into are fevers, chills, rigors, which are shaking chills, a cough with sputum production, which is different color spit, foul spelling spit, difficulty breathing, fatigue and malaise, a decreased appetite or just refusal to eat anything, generalized body aches, headaches, sore throat, congestion, runny nose, and even GI symptoms like nausea, vomiting, and diarrhea can be some of the presenting symptoms of these fall and winter illnesses. And something that's particular to our group of patients is new confusion or change in behavior. Since many of our patients have difficulty expressing their feelings and their thoughts, it's very important to pay attention to some of these objective things, specifically a change in behavior. That change in behavior really tells us that something is wrong. So, for instance, somebody who is an avid somebody who eats like 4 or 5 times a day, has a very good appetite, and all of a sudden today wakes up and doesn't want to have breakfast. That should be a red flag. If that person was able to communicate like you and I, would probably tell us, I don't feel good. But that's how he or she is saying, I don't feel well. And that's something that we need, that should be a red flag, and that should be something that should be escalated early. The earlier we catch these symptoms, the better it is for everybody. Now, those are the similarities. There are a few things that differentiate seasonal allergies from the cold and COVID-19. There aren't too many things. Obviously, a test, a flu test or a COVID test would definitely help us. But short of that, seasonal allergies will usually stay in the face. So usually you'll have like clear, watery discharge from the eyes, some runny nose, a congestion. You generally won't get body aches. You generally won't get systemic symptoms like a fever or chills. Sometimes you get a sore throat, but not generally with seasonal allergies. But then when you go to the cold, the common cold, you'll start getting those more systemic symptoms. You'll just feel run down, tired, sore throat. Um, and then when you start talking about influenza and COVID, you start patients will start experiencing fevers. So a fever is a sign of something a little bit more serious than the seasonal allergies or the cold. So remember, those two things don't have a fever. COVID and flu do have fevers. Lastly, the one differentiating thing that we've learned over the past few months with COVID-19 and all these other illnesses is this lack of taste and smell. So many patients will not be able to taste what they're eating and not be able to smell what they're eating. Noxious smells too. You just can't smell them. Um, and that's a symptom that's easily communicated if you have the ability to communicate your thoughts properly. And sometimes in our population, they're not able to do that. So certain things that we've noticed our patients do is stick out their tongue, not eat, rub their tongue, um, scratch their nose more frequently than they normally do. These are all messages to us saying, hey, I can't smell and I can't taste. And somebody who likes to eat doesn't eat. Again, that is something that should raise a red flag. So I know it's kind of confusing, and a lot of these symptoms overlap, but I hope it kind of clears up the difference between the four illnesses that we were talking about and just add some clarity to the situation.
You know, I think you could write a book right now on those last few points about our folks typically communicate via behavior, you know, because maybe language communication is not their strongest suit, you know, and being able to recognize my tongue's, you know, they're taking their tongue out, they're rubbing their tongue, they're rubbing their nose, you know, maybe in a thought of, I got to try and turn this thing on, it's not working. Those are huge points for all of us to remember and kind of go, oh, great. So for our folks that can communicate verbally, saying, hey, I can't taste that, I can't smell that, I got a fever. Two big points to say, okay, we've got to look at this, right?
Exactly.
Right. So,
exactly.
We've talked about the symptoms, and that has been outstanding. Let's talk a little bit about how do we avoid it? You know, what do we do to protect ourselves? What do we do? You know, and I think people probably have heard it, but it bears saying over and over and over again to kind of guard ourselves against these things.
Yes, absolutely. And what I'm going to speak to you about now is common sense things. None of this is earth shattering. Everybody has heard this, but what you may not have heard is that the caretaker should also be diligent. Family members should also be diligent. Direct care staff should also be diligent on the things that we're going to talk about, because many times our patients are unable to perform these things. One of the things is wearing a mask, right? If you can't stay within 6 feet away, if you're within 6 feet away from somebody else, you need to wear a mask to prevent the spread of any type of infectious illness. But some of our patients, some of our family members are not able to do that for numerous reasons. So the people surrounding those individuals should partake in the proper face mask wearing. In addition to that, the most important thing, I can't stress this anymore, is washing your hands. Washing your hands with soap and water is the gold standard because your hands are the carriers of germs. You take those germs from your hands, put them in your eyes, nose, mouth, and you're going to spread illness. So if we can wash our hands, keep them clean with soap and water for at least 20 seconds, I think that is the biggest bang for your buck. I mean, that is how you're going to prevent the illness. Now, if you can't get to soap and water, well, the hand gels, the hand sanitizers, the lotions, the sprays, they work just as well. There's certain illnesses that it doesn't protect you against, but it does protect you against, and it does kill influenza, the common cold, and COVID. These
Yeah.
illnesses that we're talking about, right? So use them, keep them, have a good supply of them. It is very, very important. Keep your hands clean and keep your mouth and nose covered because that's how you're going to catch the illness. You're going to catch it in your hands, or it's going to be on your hands, and you're going to put it in your mouth or your nose, whether it's while you're eating or whether you're wiping your mouth. It's going to it's that's how the illness spreads. Social distance is another very important point to drive home. Try to stay away from people that are not within your immediate family or within 6 feet. You got to wear that mask and keep your hands clean. The best thing is just stay 6 feet away from somebody if you can. If you can. And lastly, I think disinfecting your house and your place of living on a routine basis, I wouldn't say every hour and maybe not even every day, but routinely, maybe a little bit more diligent than what you normally have been, especially since we're in the middle of this pandemic, is something reasonable. You know, cleaning the common surfaces like tables and countertops and desks and keyboards and things like that, very important. And even pens, you know, you share a pen with somebody, wipe it down. Soap and water is good for that, a Clorox wipe, or even an alcohol swab. All of those things help curb the illness. And then, like I said, common sense things. Don't share personal household items like cups and towels and utensils if they're not washed. It's just common sense, and I think you know that also helps prevent the spread of influenza and COVID. Um, and lastly, especially now, this is the time to do it, is to get your flu immunization, your flu shot. This is what's recommended by the CDC, local Department of Health, and this is what I tell my patients all the time. You know, yes, the flu shot doesn't prevent all flu. And sometimes you do feel a little lousy after getting the shot. You're right. But that little bit of lousiness or the mild flu you get because you had the immunization really can, especially if you're at high risk, save your life. I've seen, unfortunately, people on life support because of the flu, pregnant women hospitalized because of the flu. It is truly something that is saving lives. And I know we don't see it and we don't feel it because it's such a common thing for most healthy individuals. But our patients, our people, our community really should be getting routine flu shots annually. And October is the time to get it. It takes about 2 to 3 weeks to really kick in. And the peak season of influenza starts in November. So if you haven't gotten one, get one. I got mine 4 days ago. So I feel protected.
Well, those are real, we're not asking anybody to go out and buy special equipment. Bar of soap, a little bit of hand sanitizer, some Clorox wipes, socially distance, wear your mask. These are easy things. They don't cost a lot of money and they don't take a lot of time, but they really can make a difference for ourselves and for those that we love and we support. And if you're able to get the flu shot, obviously, whatever is encouraged, we want to support families and individuals to do those things. The possibility is, we've talked a lot about kind of the possibility of getting sick. Kind of the last thing tonight before we bring our time together to a close. How can we prepare ourselves for respiratory symptoms for this season? What are the best ways to manage symptoms?
Yeah, I think that's a perfect way to end. And my biggest message to everybody that's listening is to be prepared. A lot of the symptoms that you get from these illnesses, influenza, COVID, and the common cold, There is no magic pill. There's no antibiotic. There's no one antiviral that's going to just knock it away. I wish there was, but there really isn't. So once you have the illness, I think actually before you even get the illness, be prepared and know what to do. And this is what you got to do. First, understand and know that you shouldn't stop taking any of your medications. So your medications that you are normally prescribed on a chronic basis, you should be taking. Once you start having symptoms, speak to a doctor, whether that's a StationMD doctor, your private doctor, your primary care doctor, whatever it is. Speak to them, review the list of medications, and see if there's any medicines that need to be stopped. There are certain medications, I won't get into them. There are certain medications that maybe we should hold for a few days if we suspect that you have coronavirus infection. So continue taking them, speak to your healthcare provider to see if there's anything that you should stop. Continue and stay on track with your routine immunizations. That just because you're ill, your doctor will tell you when you should and should not take immunizations. But be prepared to get the immunizations, even though you may feel some early symptoms of an illness. Make sure you have at least 30 days of your prescription medications and over-the-counter medications available and on hand. Do not let your medications run out or go to the last pill, because if we hit the same numbers as we hit in the springtime, it's going to be very hard to get to a doctor. It's going to be very hard to get these medications refilled, and sometimes it's going to be hard for pharmacies to stock these medications because of the supply chain issues or whatnot. So I would suggest having at least 30 days of your medications available. And lastly, is something that I tell my patients all the time, whether we're in the middle of a pandemic or not, is to have an emergency notebook. Everybody should have this notebook ready in the event that you do need to go to an emergency department or seek care with a provider that doesn't necessarily know you. This book should have a list of all of your doctors and all the people that chronically take care of you, along with their contact phone numbers. You should also, in that book, have a list of COVID-19 testing sites. So, where can you get a COVID-19 test should you need a COVID-19 test? Close by hospitals and urgent care centers. In the event that you do need to go, you should know how to get there and where they're located. And it being written in a book, I know it sounds kind of silly, but when the time comes and we're all stressed, sometimes we can forget a lot of things, a lot of important things. So just having it written down, I think, can really help us when we're in a difficult situation. And lastly, in that book, keep a list of the different medical problems we all have, allergies to medications, and of course, a list of medications. So this way, you have the right information for the doctor when you do see them, because I would plan on seeing a doctor that you're not used to seeing in the event that you can't get to that primary care doctor or your doctor that you're used to seeing. So having that book, it is key. And I've been saying this even before the pandemic, but it is very, very important to have, at least during these emergency times. And before I turn it back to you, Matt, I'd be remiss to say if I didn't mention, have the number for StationMD available. If you are a participant in the program, have it available. No question is too minor to call us for. We're available 24/7. I mean, it would be a shame not to use us. And if you do need to go to the hospital, we'll communicate directly with the emergency department, let them know what's happening, let them know what we're worried about, and this way it'll streamline the event. They'll be prepared for you, and will hopefully shorten the length of stay in the emergency department. So remember, if you are a participant in the program, have our number ready, test out the app, download the app, so in the time when you need us, we'll be available for you. And again, it's a privilege and an honor to take care of everybody in the state of Missouri and all of our patients, quite frankly.
Thank you very much, Doctor. Let me just close out by saying, if you participate in the Medicaid waiver program through the state of Missouri, you would have received a packet, but hey, we realized that life happened. All that packet of information is online on the DMHDD website. There is a StationMD button. You can't miss it. It says StationMD. You're already enrolled. If you are in the Medicaid waiver, if you participate in Medicaid waiver, you're already enrolled. They already have your information, okay? You literally call that 800 number. They're going to walk you through the process of downloading the app. We get testimony after testimony. They don't have the app. They call within 10 minutes. They are FaceTiming a doctor, right? So this is not a long process. This is not drawn out. You're not calling the PCP, waiting 2 hours. You're going to talk to a doctor in 10 to 15 minutes, okay? It's easy. Everything's online for you to be able to look up if you can't find it. It's there for you. You know, we at the division, we care about the folks that we serve. You know, we're an office in Jefferson City, but we're staffed with people that care about Missourians with developmental disabilities, and we want to do everything we can to keep you healthy. We want to do everything we can to keep you home and safe through this process. So we're forever grateful to the doctors at StationMD and the partnership that we have. Again, if you have questions, maybe you need some assistance, leave us a comment in the chat. We'll respond to it in the next few business days. And again, Doctor, we thank you so much for being with us. I've learned so much today. Probably we'll put some stuff out just about, you know, recognizing when you can't smell for someone that doesn't communicate verbally and things like that. So thank you so much. We wish everybody the best. I will tell you that in November, we will have another StationMD live event. That's going to be about getting ready to deal with the holidays and dealing with holiday stress. So there's a little save the date for you that we'll be announcing the date soon, but we'll have another live event in November. Everyone have a wonderful evening. Stay warm and healthy, and we'll talk to you soon.
Thanks, Matt. Bye-bye.
Thank you.